Hello, my name is Tony. I'm a UK and US trained air nose surgeon and neurologist. Today I'd like to show you how you can correct a form of dizziness called benign paroxysmal positional vertigo at home by yourself or with supervision, preferably, by showing you how to do a modified form of epileptic maneuver, because epilepsy, its original description, involved using a mastoid vibrator, but we don't have that to hand, and it's not absolutely necessary for you to have that to treat BPPV. Now, before I go into demonstrating it, I'd like to tell a little bit about the condition. It's due to crystals in the ear moving to the semicircular canal part of the ear. It could be any of the canals, but more commonly the posterior one. And when the crystals shift within the canals, it excites a balance sensitive area, which causes the dizziness. It sends signals to the brain suppresses it, which is why the typical symptoms are short spell of vertigo, which is a spinning sensation, which resolves within seconds to minutes, and it's usually triggered by head movements, either head turns or looking upwards. And the aim of these maneuvers, as with other maneuvers, is basically trying to shift the particles back into a less sensitive area of the inner ear called the utricle. Now, first you need to make a diagnosis. Now, either you would have had a diagnosis made by a doctor, and it's advisable to see your doctor first, because if you could other causes of it, and I'm assuming that you probably have done that, but you can do that at home as well. So, I would demonstrate, you can demonstrate it by lying down flat on your side, with your head turned about 45 degrees to the side. I would suggest that you center a pillow in the nape of the neck, just between the neck and the shoulders, to reduce the strain on the neck. You don't have to overextend your neck, because that may cause pain, and you may be able to elicit the signs without causing yourself any injury. And I'll demonstrate. So you get your pillow, lie down flat in the bed preferably, but I'd stay to the side just for demonstration purposes. And then you lie down flat with your head turned to the side, 45 degrees, and you go down. And you stay there for about 30 seconds. Now, if you're lying on your side, on your back, with your head turned to the side to the right, and you have the dizziness, that would suggest you have right BPPV. If you don't get a response, sit upright, wait for about 10 seconds, turn your head to the left, 45 degrees, and then lie flat back. And stay there for 30 seconds. And once you have the spinning sensation, ideally, stay in that position till it settles down, and you can do a modified epileptic maneuver to correct it. Because basically what you're going to do is turn all the way around to the other side and then sit up. And I'll demonstrate. I will just demonstrate as you would do for a left BPPV. So you make a diagnosis while you're lying down flat on your back, head turned 45 degrees to the left. I'll demonstrate. Now with the spinning sensation confirms the diagnosis, wait for a while. Then after 30 seconds, look upright towards the sky with the chin up. After 30 seconds, turn around, 45 degrees, 30 seconds. Then turn onto your side, knee up, turn to your side, still supporting your neck. Stay there for 30 seconds. Then I would ask you to look downwards as if you're looking at the floor, and stay there for 30 seconds. Sometimes you do get a dizzy spell while this happens. Don't panic. That usually suggests that the particles are moving into the right place. So don't panic. Then after it's settled down, tuck your chin in, fold your hips and your knees so your feet are dangling at the edge of the bed, like so, and then you sit up. With your chin turned to the side and tucked down. Once that passes, you can repeat the maneuver to see if it comes back again. I hope you find this helpful. Sometimes I generally advise patients not to lie down flat or to move their head suddenly or bend down suddenly, certainly for the first 2 nights. I would advise that you sleep with 4 pillows, so you're virtually upright for 2 nights. And for a week afterwards, lie on side that didn't cause you the dizziness. And hopefully, this should reduce the anxiety you have with these spells sometime before you actually see the doctor. If you have any queries, contact your local ENT surgeon. If you have a physiotherapist, they're also very versed in doing the maneuver. Or you can contact me. My email address is tonewa@hotmail.com or owatod@gmail.com, or you could go to my website, www.tonewa.com, for information. There are other maneuvers you can do, but I'll probably release other videos. There are different exercises you can do, but this is by far one of the most successful ones and it's relatively easy to do. Thanks for viewing.